We will begin the webinar shortly. All right, welcome. My name is Sharon Roberson, and I'm the president and CEO of the YWCA Nashville and Middle Tennessee. And welcome to our January Lunch and Learn regarding childcare. It's entitled Childcare Matters, Equity in Early Education. As many of you know, we have these important community conversations every month at the YWCA. The reason for this is we want to inform our community and the community at large about issues of equity and justice. The mission of the YWCA is eliminating racism, empowering women, promoting peace, justice, freedom, and dignity for all. It is very important when we discuss these topics that it is our mission at this YW to invite individuals to our conversations, but not to indict, because we know there are people who need a greater understanding of these issues to fully appreciate what the part of our mission of equity and justice means. Today's webinar, Childhood Matters, Equity in Early Childhood Education, is such an important conversation. A little bit of the backdrop. Since 1868, YWCAs have been trailblazers in providing early childhood programs. YWCAs across the nation serve over 200,000 children annually through childcare. We have Head Start programs and pre-K programs. These initiatives not only promote child development and school readiness, but also enable parents to secure employment. Many of you may not be aware of one of the largest programs at this YWCA in Nashville, Middle Tennessee is the Weaver Domestic Violence Center. One of the barriers for individuals seeking to move forward from a domestic violence relationship is the inability to have childcare. You must take care of your children before you can take care of yourself. There are barriers to affordability and accessibility, and they continue to disproportionately affect low-income families and communities of color. Before we begin, it is important to stay true to those organizations, the Nissan Foundation, the Harnish Foundation, and AllianceBernstein, who have all been long-term supporters of this portion of our mission, and we thank them greatly. What we will do today, we will explore systemic barriers to childcare affordability and accessibility at the local, state, and national levels. We will highlight policy and advocacy opportunities for equity-based solutions. And we're going to discuss how the YWCA's mission aligns with promoting resilience and breaking cycles of poverty through early education. So why are we doing this? To dig down a little bit deeper. Childcare is more than just a service. This is more than just people doing jobs. It is a lifeline for families and a cornerstone for building equitable communities. By addressing affordability and accessibility, we can lay the groundwork for a future where all children and families thrive, regardless of their income and background. For those of us who have done this work for some time, we do know that the foundation of success for children is largely based on those early years when resilience is given to them through programs such as early childhood education intervention. I will ask each of our panelists to come to their screens, and we're going to ask them to introduce themselves and how the work that they do fits into the mission and into this particular topic. I'll start with Miss Melanie Shinbaum.
Thanks, Sharon. I'm excited to be here today. I'm Melanie Shinbaum, the Executive Director of the Nashville Early Education Coalition. And we formed as a coalition just about 6 months ago. And our goal is really to address issues around affordability and access in Nashville to high quality early childhood education. And our focus is really mirrored on other communities doing similar successful work, which is bringing a variety of stakeholders to the table together, because we know that sitting together with folks that we might not otherwise see and interact with, we can create some pretty amazing solutions. And so that's what we're focusing on, really prioritizing 4 sectors of the community. So first and foremost, childcare providers like Alyssa, who you'll hear from. She's on our advisory council. We know that childcare providers, first and foremost, know what they need to be able to deliver those high quality services. We are partnering with the business community. We know they need access to childcare for their workers, government, both state and local, as well as private philanthropy.
All right. All right, we'll go to you, Miss Alyssa Garnett-Arno.
Hello, I am the executive director of St. Mary Villa Child Development Center here in North Nashville. We have been a part of the Nashville community for 160 years, and we are currently expanding our operations to include 3 new additional sites to help bring more quality, affordable care to as many families as possible.
All right. Dr. Dionne Blue.
Good afternoon. I'm Dionne Blue. I'm the Chief Impact Officer for YWCA USA. And although I don't work directly with child care myself, as a network, YWCA is one of the largest, if not the largest, network of child care across the country, with 194 local associations, many of whom providing child care or some form of assistance related to child care. So that's kind of, we'll talk more in terms of how that piece connects into the larger mission.
All right. And Miss Katie Growden.
Good afternoon. I'm so excited to be here in this space with you all. My name is Katie. I am the state manager for Save the Children Action Network. We're an advocacy organization focused on making sure that we are making policy and systemic impacts that benefit young children and their families, particularly in the areas of access and affordability to childcare, and early childhood education experiences, and also child nutrition. I come at this work as a career early childhood educator, and something I am incredibly passionate about. And I will just take a moment to share with you that advocacy is for everyone, that we all have voices that we are bringing to the table, and we can create change together.
All right. We'll go back to you, Melanie. Nashville Early Education Coalition. Your work focuses on expanding access to early education in Nashville. Can you speak to how affordability issues disproportionately impact low-income families and communities of color in our community?
Sure, Sharon. So affordability is one of the most significant issues that families, both of low income and communities of color, face in Nashville when it comes to early education access. So quality childcare, there was a headline recently about this. Many of you might have seen just, I think, last week. Quality childcare can cost as much as in-state college tuition. I think in Tennessee, it's just now tipped over the cost of our state universities. So it makes it really out of reach for a lot of families who are already struggling to meet basic needs. And for communities of color, longstanding systemic inequities such as wage gaps, fewer job opportunities, and housing instability further compound this issue when they're forced to really choose between those limited resources in their family budget. So oftentimes what happens is they'll make difficult trade-offs, such as foregoing employment, right? Or seeking lower quality care, or relying on informal arrangements that don't support a child's developmental needs, but also don't really support the parent's workforce needs to be able to reliably hold a job either. And so without access to affordable, high quality, reliable care, those children often start at a disadvantage, which perpetuates the cycle then of inequity and limited opportunities. So addressing affordability is critical to ensuring that all children, regardless of their background, have an equal start to life.
Yes, of course. All right. Alyssa, Garnett-Arno, St. Mary's Village Child Development Center. This is an iconic force in our city because you're really helping those who can least help themselves without support. Operating a child care center often means you have to balance quality of care, but there are always financial constraints. You have rising costs, funding gaps, grants come and go. How does your ability to serve families in need, how are they affected by all these competing issues?
That is a question we struggle with every day. And it really comes down to, we have to decide which things we're not going to take on, or which programs we may not be able to provide, or we can't do this activity because we want to make sure we're providing care for this family because they can't afford even to pay on the scale. So we provide childcare on a sliding fee scale. So it's based on your household income. And even still, we have families that can't afford the lowest rate of childcare successfully. Some months they can handle it, and then they go 2 or 3 months where they can't handle it, and they're paying the minimum to keep them here without me saying, hey, we can't have you here anymore. And then we know that there are families that need us to have them here, whether they've paid or not, because we don't know that they're getting 3 square meals a day, that we don't know that they have a warm house or somebody stable to watch them and take care of them and meet their needs. So for us, it's a moral dilemma, because we are in this business to take care of children and their families. And it's a dilemma from a business standpoint because we have to be able to open the doors and still be able to provide 3 meals, pay our employees a reasonable wage, and take care of the building that we provide care in, as well as give them the opportunities that they may not be able to get outside of these 4 walls, and exposures to things that they may not have. So there's a lot of finagling that happens on a daily basis to make sure we're providing quality care. And it doesn't stop whether you raise tuition or get a grant, or it's just a different problem for a different day at this point.
Oh, yes. All right, Dr. Blue, we've been talking a little bit about what's going on locally, but we're going to get to, with our last 2 comments, there's a national perspective on this. We are not alone in having these issues. I find it just amazing that one of the most significant work that our society can do, helping those who are very young, helping them move forward and have successful lives, is such a struggle. But from a national perspective, how does the YWCA mission intersect with the systemic barriers to affordable childcare, particularly for low-income families and other marginalized communities? Because it's really a poor people's issue, but it also goes to middle and really all women. It's a woman's issue.
And to your point, it really, even though it disproportionately negatively impacts low-income women and families, it really is an issue that goes across for a lot of different reasons. And so you think about the national perspective of YWCA as a network that really is nationwide of YWCA local associations. It gives us a kind of a unique approach to be able to really address issues, to your point, at a systems level, and for our mission to be as intersectional as eliminating racism, empowering women, promoting justice, peace, freedom, dignity for all. It really does get to how can we really look at our advocacy from a state and national or federal standpoint, and we are able to support as the national voice, able to support the entire body of local associations and really helping to advocate for the things that they need in their communities, because all the communities are different. And so since local YWs really serve the needs of their immediate community, what they might do might look different, but still kind of going along the same vein of supporting women. And so there are a lot of childcare because women who are leaving domestic violence situations or who've had other traumatic things happen to them, they need to have trusted, affordable, high quality childcare that is flexible to their lives so that they can get back on their feet. So for us at this national level, really looking at systemic barriers of how racism, sexism, all these other forms of oppression really impact, depending on the geography, parts of the country, it looks different, but we're able to really help connect dots, even for local associations, to work together on the sorts of things that they need to fight for and against when it comes to improving childcare and access to
All
childcare.
right, yeah. Ms. Growden, you have a long history of working for children, and you mentioned earlier that all of us could get, I guess we were in our pre-conversation about all of us can be advocates or activists in this area. And the Save the Children Action Network does advocate for children's rights at both the state and the national level. So we've heard a little bit about what's going on locally. It bleeds over into state and national issues. What role do state policies play in the child care debate?
So there are a couple of different ways that our state lawmakers kind of affect this conversation. One is in funds allocation. So we have federal funds that come into the state that are decided by Congress, and those levels are set. And when those monies flow into the state, our legislature, our General Assembly, gets to decide how those funds are allocated. So one of the things that we need to make sure that we are doing is paying attention to how they allocate those funds and whether or not those funds are flowing. Tennessee has a history of kind of stockpiling those funds or earmarking the funds, but then those funds are kind of caught in a log jam and they don't necessarily flow to the families that need them. So that's kind of one area of the state. We also know that this is a multi-layered problem. This is not something that can solely be solved at the local level or the state level or the federal level. All of these entities need to be making sure that they are making contributions. So we really are looking at the state making investments in early education. We know that budgets are moral documents, and we need to hold our legislators accountable for making financial investments that are going to support early education for the benefit of all, for the benefit of the kids, for the families that they grow up in, for the businesses that need a workforce, and for the future economy of Tennessee. And then also our state legislators are, at this point, thankfully, looking at barriers to access and barriers to expansion of early childhood education programs. So we are holding them accountable for looking at where there are unnecessary regulations. We want to make sure that the regulations that support quality and that support the workforce stay in place. We want to make sure that our kids have those great experiences, but there are some red tape kind of things that we need to make sure that we are addressing so that people can stand up early education centers, that people can do quality childcare in their homes and in their communities without red tape.
Okay, all right. All right, we'll go back to you, Ms. Shinbaum. We've talked some about Nashville, we've talked about Tennessee, but we know that there are systemic barriers, and we've alluded to that. But what systemic barriers in Tennessee exacerbate the affordability crisis, and what policies have proven effective elsewhere? Because there may be some other models that we could follow or implement in this state that would help us to do better for these children.
Sure. So yeah, there are several specific barriers, and the first one I'll speak to, Katie just referenced, and that's really the workforce of childcare. So this data is fairly recent, as of 2022. In the state of Tennessee, childcare workers made $10.46 an hour, as compared to their elementary and middle school counterparts who made almost $28 an hour. Meaning they make more than 2.5 times more. And so, and I think we would all agree, no one in education is paid equal to the value they bring to society. But I think oftentimes people might not realize the difference that even exists between early childhood education and their elementary through middle school counterparts. So what that means is the ECE workforce is 6.5 times more likely to live in poverty than elementary and middle school teachers. And we also know the data tells us that many are women. There are a few men in programs, but many are women, and also many are women of color. And so that's again where the childcare crisis is so complex. Someone else mentioned multi-layered, because Alyssa can't just increase rates, right? Parents can't afford to pay more, but yet also Alyssa has a workforce that deserves and needs a living wage. So all that to say, limited state funding for childcare subsidies, eligibility requirements, and also a shortage of providers that are willing and able to accept subsidy payments make it difficult for families. So there are many quality programs out there, but they don't necessarily accept the subsidies. And so that pretty much immediately eliminates a lot of the available programs to many families. And then additionally, the rising operational costs. So we already mentioned the workforce, but workforce shortages, right? And increased demand for quality improvements. It's that push-pull of, we want high quality for children, and yet we also want an environment that people are excited to come to work in. And oftentimes those two can work in conflict of each other. And so, like I mentioned, parents can't afford to pay higher, but providers need additional dollars to be able to support the workforce and make this a job that people who have this passion, and there are many, can afford to stay in. So looking at policies that have worked elsewhere, there are states that have implemented programs that have provided free access to high quality early education. You'll especially hear universal pre-K. Some of the challenges around universal pre-K is community-based programs like what Alyssa runs oftentimes then lose some of the children where the ratios are higher and allow for a little better affordability per child, cost per child. And then so you're left with a community that is relying on community-based providers to provide care for infant and toddlers, which, as it should be, right? It's a much lower adult educator to child ratio. So that impacts the cost. We also know that wage supplement programs are working across the country. There were significant dollars during the pandemic that states were able to put towards shoring up the workforce. And in Tennessee, the Department of Human Services did just that, and has continued through last year even. And so that bonus program has allowed educators to receive a bonus in an industry that before those bonuses through the pandemic really were virtually unheard of. Again, the economics of the system just don't allow for the type of employee benefits that other industries do. So in Tennessee, specifically adopting a mixed delivery system that braids public and private funding, expanding subsidy access, and investing in the early education workforce could make a big impact. And that, especially that mixed delivery, that's something else that the Department of Human Services has put resources towards to support partnerships between businesses and childcare providers. So if there's a childcare provider in your business's community, what would it look like for you all to partner together for the benefit of the community and your employees? So these are some of the creative ways that other states are starting to address, successfully address the challenges.
All right. Alyssa, you're in the business, so to speak, of providing childcare. And something that Melanie alluded to, this system of some not even wanting to take, some providers not even wanting to take any of these supplements. So obviously there's a disconnect or some sort of issue there with the way the state goes about its business. But what meaningful state level funding reforms look like? What would that look like to you? And how can we improve this experience? You as a customer of the state receiving funding, but then providing to these families, there must be some sort of disconnect or some way we can make this experience better for all parties.
I think the first thing that we have to do is to change it from childcare to education. Because if we can change that mindset that we're providing an education, then it opens an umbrella of possibilities. Because currently many people think this is babysitting, and I can assure you that my staff is not babysitting on a daily basis. And so if we can start changing that mindset, then the state level funding can change, because now we're providing education, and that opens a door and a possibility for more funding resources. If we were under an education umbrella, just like school districts get certain amount of dollars to provide an education for X amount of children, the same thing could then translate to capacity numbers that we are able to provide for on a daily basis. I'm not going to proclaim that I have the answer to the funding question, because I think there's multiple things that could probably work, but we can't even try them because we have to have people who are willing to sit at the table and work through those suggestions and see if they're going to actually work and how can we make them work better. So that would be my thoughts.
Yes, yes. All right, Dr. Blue. The YWCA, as we've already mentioned, provides child care services or child education services across our network. But we are also the largest provider of domestic violence and sexual assault services as a network of any provider in the country. How does our work in the domestic violence, sexual assault world informed our approach to child care or child education, accessibility, and equity?
Certainly. So, as I mentioned earlier, excuse me, a woman who may be, or someone who may be escaping a situation, or a survivor of intimate partner violence, needs a place where they could be, where they can leave their child that they trust, that they know their child will be safe, so that they can, either go to work, look for a job, that sort of thing. Transportation can be an issue, all the things that Melanie mentioned earlier, in terms of some of those barriers. And so being able to have child care, or child education, which, Alyssa, I love that, being able to have an early child care or early childhood education option that won't put them back in danger, won't put their children in danger, is of utmost importance. And so really thinking about, how do we have that as even part of a wraparound service for the clients that you serve. Yes, they need childcare, but they may need other things, but childcare is a part of that wraparound. And so really thinking about the fact that anytime we are serving women, we're also serving a family in a lot of ways. And so being able to have childcare available along with the other services that we provide around domestic violence is crucial. I was reading about a case in Oklahoma where a woman had to leave her child with her abuser, and and go to work. She came home and something tragic had happened to her child, and she was charged for that. Even though she wasn't there, she didn't do it, but she didn't have any other place to leave her child. So a lot of times, a woman may go back to a situation because they don't have childcare, because they can't afford to not, if they could afford the childcare, they can't, as part of all the things that they have to sort of make that decision, as Melanie mentioned that too, that they may have to decide, what's going to be the thing that I sacrifice in order to be able to have, childcare, or to be able to go to my job. And so having this as an option really helps to keep them safe at the same time as they're trying to gain stability.
Now, very important, because the particular case you're talking about happens really, unfortunately, every day in this country. A mother's having to make very difficult decisions. In hindsight, others will ask, well, how could she leave her child with someone like that? But it could be a choice between going back into another violent relationship or being homeless because you don't, or unhoused because you do not have a job. And if someone told you you would lose your job or you could leave them with someone, it's a difficult decision, it's a terrible decision, but we do know that women have to make this decision every day. And many times it will lead you back to an abusive relationship because you need someone to take care of your children, or you want to be there with your children. So, Ms. Growden, Katie, we're in the midst of the start of a Tennessee legislative session. Most of the issues involving education, especially in special sessions, has been called, really are dealing with children in higher levels of education as far as grade-wise, kindergarten through 12. But we know that there is the child education or care issue, and the affordability and accessibility. And are there things that we could tell this audience that they should be paying attention to when it comes to these other children that could be left out of all these other conversations? Is there something else that we can tell our listeners to get them ready to advocate on behalf of the youngest of those needing education?
Thank you for asking that question. I will say one of the things that we are really trying to emphasize, as Alyssa said, everything that happens in those early years of a child's life, everything is education, for better or for worse. And so we need to make sure that we are investing in quality, that we are making sure that those early years are as enriching as possible, and that we are acknowledging that all childcare is education, whether it's at home or center-based or otherwise. One of the policies that we are looking forward to this session would be establishing what they're calling a Promising Futures Fund, which would be a kind of a chunk of money set aside in the budget that would be able to fund things like early education scholarships for families with young children who are of low and middle income. Additionally, that Promising Futures Fund would have the opportunity to support some professional development fund opportunities through things like apprenticeships and apprenticeships, and also to be able to provide additional wage supports for retaining early childhood staff. So that is all kind of housed in that Promising Futures Fund that we are looking forward to hopefully seeing cross the finish line this year. The other thing that we are looking at is the creation of an office of early care and education. This is an initiative that is being spearheaded by Tennesseans for Quality Early Education, and would create a unified voice for early ed in Tennessee, and create one office that kind of houses all of the administration and licensing for early education experiences. Right now, the system is so fractured. There are so many sets of rules, so many barriers and questions and complications to the system. So having one office of early ed would really make a huge difference for providers and for families navigating the system. And those are the big pieces we're looking at. Another thing that we would like to try to explore is opportunities to make sure that professionals who have lots of experience and lots of just, years of professionalism, finding ways to acknowledge that experience as equitable to some of the formal education experiences that people have, so that those people can receive the same kind of wage supports that that other teachers are receiving. If you've been a provider of childcare for 30 years and more, but are ineligible to receive any of wage supports because of your education level, it's not necessarily an equitable system. It is a system that particularly, targets people of color and, family care homes, where someone is providing services in their community in a licensed or unlicensed family care home. So those are kind of things that are coming along. I don't have bill numbers for those particular things yet, but I'm happy to drop my email in the chat, and folks can kind of reach out and get updates on those bills and follow as they work through the legislature.
Oh, thank you. We'll go back to Melanie Shinbaum. You mentioned earlier about some providers not taking certain, I guess, benefits or vouchers for health for child educational care. I do know that at our Weaver Domestic Violence Center, that's one of the things we try to work to see if we can get them some sort of vouchers or some sort of support so that they can have childcare. And it's a constant struggle. And I've never truly understood why it had to be such a struggle, but I know that it is because the people we work with, the victims of domestic violence, have to go through this struggle on a daily basis. Now, there must be some benefits and drawbacks, but what are the potential benefits and drawbacks of such programs offering, some sort of financial support for those needing childcare, particularly for underserved communities?
Yeah, great question and points. So they can provide essential financial relief for families. It can cover either a portion or all of the cost of early education. Oftentimes when I have worked as a provider, a high school student who is navigating life with a newborn was able to finish their high school degree, right, because of a childcare certificate. So access really is important. For underserved communities, just in general, they offer flexibility. So it allows parents to choose what provider meets their best needs. One way I heard this described was like thinking of puzzle pieces, right? So one size fits all in early education, it really wouldn't exist, right? But because what we would want is for every parent to have access to whatever situation and opportunity would feel best for them. They might need to prioritize location, right? I need to be able to afford a center that is close to me. I might need to be able to prioritize a special need that maybe my child needs assistance with, and a particular center that has that expertise or is willing and able to partner with an external provider for that. It might be that someone prefers a faith-based program or a home-based program, right? So there's all these choices, and childcare certificates can go towards all of those, right? There are providers in all of those avenues that accept certificates. I think when you think about the barriers, I'll say on behalf of providers, it's the state has increased reimbursement rates tremendously over the past 2 to 4 years.
Okay.
However, the cost of high quality care, particularly for programs serving low income families that offer sliding scale scholarships, still does not fully cover the cost of the care. Alyssa mentioned a family needing 3 meals a day, right? There's lots of programs that don't offer meals. But the programs that do, oftentimes the families that come there need access to those nutritious, reliable meals. So oftentimes the cost of those types of programs just do cost more. Food is a great example of that. Then the other thing is that I think for a family, especially thinking about YWCA, if a caregiver, especially a mother, is trying to juggle the balance of getting a job, getting childcare, getting a new life set up, a new home established, those support networks are really hard. And so it's also just not a lot. The state has done a lot to remove barriers to apply. It's a much more electronic process than it used to be, which I think is helpful. But just acknowledging that families that are living in crisis, it is still a barrier, right? It's still something that they have to be able to prioritize. But all that said, in states and in areas where we as a community support both from providers being able to accept it from a resource standpoint and parents to be able to use them, it does really allow opportunities for equitable access. And one thing I'll say also from being with organizations that did offer intentionally diverse populations, it's great for kids, right? Because early education is one of the most non-diverse environment that an individual will be in their entire life. And so when we can intentionally give children a diverse opportunity to be around people different than themselves, our kids didn't know the difference. We would do family events and parents that might never sit and share a meal together would be sitting around the table. Those kids, they're just running around. It's their day-to-day best friend, right? They know no difference. And so I'm also just a big proponent of organizations that do really allow for this intentional blending of families. I think it only makes our community stronger.
All right. Alyssa, let me go to you. What are the potential benefits and drawbacks from, boots on the ground, grassroots provider? What are some of the benefits and drawbacks of these kinds of programs providing, vouchers or certificates for individuals needing childcare?
To Melanie's point, I always tell parents that our program looks like real life. They're about as diverse as you're going to get it. We have families that make $500,000 a year, and I have families that make $20,000 a year. And I always tell parents, we don't care what shoes your child has on or what car you brought them to school in, or if you had to take the bus. When you walk in this door, you're part of a community. For parents, parenting sometimes feels like you're on an island, like you were up all night with an infant and now you've got to go be an adult all day and look like you have your life together. And when we have community events, you can look around the room and go, oh, you were up with your infant too? Like, what are you doing to try to get them back to sleep? Or, there's things that you just don't have conversations with when you're at work with somebody about parenting that you can have in this community and you don't feel like you're alone. I think for us, the childcare certificate program is great, but there are some things that need to be fixed. We as providers, we are the family's first point of contact about their voucher. They think that we can fix it. We have a contact, we know all the things, and we don't. Unfortunately, as providers, we're left in the dark until we get a piece of paper that says, or an email that says, hey, this family has access to their certificate and they've chosen you as a provider. So we can't help families even apply because they're separate entities essentially. So it would be amazing if we could have access to somebody at a state level that says, you know, I have this family in front of me, they have a certificate, they thought they had everything submitted, you sent them an email that says they're missing X, Y, and Z. How can I get that to you so you don't turn off their certificate next week and they're without care? We have lots of families that lapse in care, and we try to figure out, or lapse in their certificate, and we have to try to figure out how to juggle that but keep them here, because we know that their parents can't not have care, and we also know the state moves at their own rate. And so there's pros and cons to the certificate program. Yes, it helps families. Does it help enough families? No. Do we have access to get more help for those families as providers? No. So it would be great if the program allowed us to have a contact at the state level to help these families get what they need and answer the questions that they need right now, versus them waiting on hold for 3 hours or trying to go down to the office to get somebody to answer their question when they can't always give them the information they need. So the certificate program is great, but there are some things that need to be fixed to make it more effective.
Basically, more responsiveness. There has to be something that makes it a lot easier, because I couldn't imagine if you were depending on this care, because they're not depending on it just so they can sit back, you know, and watch soap operas. They're depending on it because most people are trying to find jobs and employment. And then if there's a glitch in the system, there's no easy way to fix. This is what we need to fix. This is what we need to do. Okay, Ms. Growden, Katie, same question, going to the potential benefits and drawbacks of these programs. I'm beginning to see a theme. They're not easy, they're cumbersome, and I could see why, if you are a provider, you might hesitate to even go through this, because you could end up with someone in your center, they lose funding, and you need that consistency, right? You know, operating a nonprofit myself, consistent funding is the name of the game.
Well, I think another thing that we need to make sure that we are supporting is the timeliness of reimbursements for any kind of a certificate program or the potential for this Promising Futures Fund. We need to make sure that payments are made in a timely manner so that these providers have those funds. There have been reports historically of really long wait times and gaps in reimbursements, which, as you know, if you're running a business, you need those funds this week because you have bills to pay this week, and not have to wait for weeks and months to make sure that those funds are coming in. I do think that, the current program and potential future programs do help to provide, affordability for families, access to more consistent and high quality options, and kind of alleviating some of that stress on providing childcare expenses can make a difference in other areas of the family's income, so that, maybe they can, change their transportation plan for their family, because now with a childcare payment, they have a little extra money to set aside to be able to purchase a vehicle, so they're not relying on public transportation systems, or that they can buy more fresh fruits and vegetables for their family, because, those expenses of childcare have been alleviated. So I think there are a lot of great benefits to the certificate programs and the potential of the new scholarship voucher program through Promising Futures. A couple of the things that we are trying to make sure that are on the radar as those things come up, because they could be potential barriers for families, are looking at ways to make sure that some of our family home providers can get licensing for their homes, so that they can receive those certificates and provide care for families who are receiving those funds. At this point, if you're not a licensed provider, you can't, you can't support families who receive those funds. So that is something that we want to make sure that we are kind of building in. We know that those home providers are a huge part of the care system in Nashville and across the state of Tennessee. We also want to make sure that we are having a really fine point on the definition of quality. At this point, there are a couple of definitions of quality, particularly because we've got different entities that license childcare. And so we want to make sure that the definition of quality is very clear and that folks who are receiving those subsidies are receiving quality childcare, that we are really investing in those children and their early formation. Another one of the kind of tricky situations that we've continued to face is the work requirement for some of those subsidies. And we run into this cyclical situation where someone can't receive childcare subsidies because they're not employed, but they can't get employment because they don't have childcare set. So we need to make sure that what the systems that are in place have some flexibilities built in so that as someone is seeking employment, that they can have childcare to be able to do the interviews, to be able to secure employment, and then, continue to receive the subsidy. But if you don't have someone to, help make sure that your child is safe and cared for, then you're not getting to the job interviews. You're not going out and doing all of the applications. And obviously you're not, showing up at work on day one as an employee because you don't have childcare set yet. So, definitely some work that we need to do as we are kind of putting investments to solving the problem to make sure that we are looking at all of these underlying barriers.
Yes, yes, yes. And we do run into that issue, and we try to help our families, the issue of needing the work requirements, which, there is a movement and a trend on a number of fronts. You need to have a job and work before we give you any benefits, not looking at how the benefits only function well if you're able to get jobs and get work. And that to me is one of that's a whole other webinar that we need to have on that single issue, because it's important. Dr. Blue, going back to you, because the YW, as I said, our mission is eliminating racism, empowering women, promoting peace, justice, freedom, and dignity for all. Within looking at an equity and diversity lens in education, what strategies have proven most effective for addressing racial and socioeconomic disparities in early child care systems?
So my experience is that addressing disparities in early child care systems is similar as it is with other systems. And so even, obviously even into K-12 or higher ed. And so I see it as, being able to, first, that equitable compensation, because the point was made earlier that early childhood educators are not paid always at the same rate as certified teachers, things like that. So that is one piece of it. Also, being able to really engage families is helpful. Thinking about being in partnership with families in terms of how do we, best really, diversify classrooms, all that, bringing families in to be part of those conversations to kind of, build those bridges across with other families and things like that are inside of that are part of the program. Also diversifying staff when you think about research shows that having educators that mirror the community, that mirror the classroom, is a benefit for children and students, and is not doesn't negatively impact students who are not, a part of that culture. I think wraparound supports for families is also a way to really think about hitting disparities, because to the point that's been made earlier, childcare is one issue, but it doesn't exist in a vacuum. So you can try to address one issue, but unless you're really looking more holistically at what are the things that a child or a family is facing, then you're not going to be able to really get to the systemic barriers. I think that data is also, I feel like data, is always a part of every conversation, but really looking at, what being able to disaggregate that data by race and gender, ability, all those things, to see what are really the needs of the families in our community. How can we, do things differently to make sure that we're really addressing and being mindful of the types of diversity, the types of things that come into the door. And I think, I think as part of the wraparound trauma-informed practices, so there are a lot of things that really is good practice. Good practice is also going to be equitable practice. I always say that there's no, when you're talking about high quality education, you're talking about equity, because otherwise one doesn't exist without the other. So really looking at all those pieces, I think, can really help to improve equity and address some of those systemic barriers.
All right, we're reaching our time, and we actually had 3 other sections, but this has been such a fruitful, wonderful conversation. We may have to have part 2, but we know we have to touch on advocacies, intersectionality, and call to action. And one of the things I want to make it clear is that child care of any kind, childhood education, children are often just viewed as a woman's issue. Women need to take care of that, and women do hold this up. We hold together families, we hold together anything that involves children. However, we need to have, especially our legislators, understanding this is a family issue. If you truly are dedicated to our families, if you're truly dedicated to our society as a whole, then this is an issue for all of us. It's just not something for women. I think that sometimes I've found they are often colored by their own personal experience of wifey, so to speak, at home with the kids. And so they're thinking, well, that's her issue, and not really looking at it from a societal perspective, or people who do not have that sort of privilege of being home just with the kids, with someone else bringing the income, because they're holding, most of these women are holding down much more than just the family side of things or the home side of things. But really quickly, shortly, each one of you, I want you to say what your vision for equitable child care system that supports both families and providers. What would that look like? I'll start with you, Ms. Shinbaum. What would that look like? What would your dream look like?
Yeah, I love this question. I think it would look like really what we've spent today focusing on, right? Where every child and every caregiver could choose and have what works for their family, acknowledging there's not one size that fits all. And things might change, right? A family might need one type of care at one point in their life and something else. And then I'll also just echo, anyone that knows me, I just have a huge heart for the providers, the educators that do this work. And so much like your correlation before, Dr. Blue, we can't have high quality education and what parents need without also ensuring a living wage that's equitable to the work that the educators experience. And so a perfect world would have both of those, and I think it would be pretty amazing. And I think we'd have a lot, the impacts in other parts of our community would just be astronomical.
Right. Ms. Growden, really quickly. Magic wand time.
In a perfect world, societally, legislators, parents, grandparents, people who have not children yet, would recognize the magic that is birth through 5 years. And we would be unified in making sure that every child, no matter where they are, no matter who their parents are, had a start that would fuel their future trajectory.
Thank you, Miss Garnett-Arno.
I mean, when you're on a panel with very smart women, they've already taken the answer. Yeah, I would say that I echo what Katie and Melanie have said, and even some of the things Dr. Blue has said. It is important for us to realize that this is not a women's issue, it's a community issue. And if we're investing in the community, then we're investing in the future of that community, because the dollars we put in now come back 10, 7, 10, however many folds you want to fold it later in life. And we're going to make a bigger impact later if we invest now.
Yes.
And so I think that's important for us to understand to make a difference.
All right, and Dr. Blue, close us out. We got a national network. What do we need to do? What would be a dream state for us? What would be a fabulous outcome?
I think a fabulous outcome would be really about the kids and really about the outcomes for the kids. So it's one thing to say we want things to be equitable, kind of access wise and all those things. But on the other side of that, for me, the outcome would be that all children are healthy, happy, ready to start their journey into their education, ready to learn, ready to grow, and without harm, So I think it would be that for me.
Well, thank you very much. This has been fabulous. Child care, child education does matter. We need equitable, quality child care, early education, however you want to term it, in our community, in our nation. So I thank this panel so much. This has provided so much education, of course. This is also available. We have many people that look at these discussions over and over again, but this has been fantastic. So thank you very much for your time, and thank you for everyone that's attended this webinar.